When making a decision about having plastic surgery, one of the most important issues we can discuss is where to have your procedure. For example, let's say you've decided to have a natural neck lift. There are three essential options we can offer to you. Number one, to operate in the office. I'm lucky that in my office I have an office operatory. We have an autoclave. I have wonderful assistants. We have a pulse oximeter. We can monitor you. We have an electrocautery. I have great surgical instruments. So what happens in the office? Essentially in the office, someone will come in and we check your vital signs. And of course, your vital signs need to be stable. And that brings up an important point. If you're considering having plastic surgery in the office, it's very important that either you do not have any medical problems or the medical problems you do have are well controlled. For example, if you have uncontrolled high blood pressure, uncontrolled diabetes, if you have lung and heart problems, we're probably not going to recommend that you have a natural neck lift in the office. So let's get back to what it's like to come into the office. So you come into the office and you have your vital signs checked. Next, you take pills, including a sedative. We can give you an antibiotic. We can give you sometimes a narcotic, sometimes Tylenol, sometimes Benadryl. And most importantly, we can give you a sedative by mouth. Now, it's important that you know, in the office, we do not start an IV. So in the office, you take the pills and we allow you to become very relaxed. Then we start the numbing process. Now, typically, I'll inject the lidocaine and marcaine with needles, and so that stings. It's tolerable, especially if you're relaxed after getting the oral sedation. And then we let that soak in. So then I numb up the deeper tissues with a very dilute local solution called Hunsted's formula. And we let that soak in. So as we prepare for the surgery, you are very mellow, you're numb, but you're awake. And keep in mind, we have not started an IV. We can carry out the procedure, we monitor you, we check in with you, you're able to speak to us. If need be, you could even get up out of the chair, but you're awake, you're numb, and you're comfortable and very relaxed, but you're awake. Where else can we offer you a procedure? We can go down to the surgery center, which is downstairs. There's another surgery center just 2 blocks away, or we can even go to the outpatient surgery center at the hospital. So the big difference between having a procedure in the office and going to the surgery center or outpatient surgery center at the hospital is, at those facilities, they start an IV. There's an anesthesiologist there, there's 1 or 2 nurses there, there's a surgical assistant, and you just tell the anesthesiologist how deep you want to go. You can have a general anesthetic, you can go twilight, you can go daydream, you can get very sleepy, we can just barely take the edge off anxiety, and then I numb you up and you're monitored and you get those same medicines right into the vein, a sedative, a narcotic, a relaxant, an antibiotic, and we carry out the procedure. Following that, we monitor you in the recovery room, and there's an opportunity for you to stay overnight, but most patients go home or go to our aftercare cottage or stay in a hotel overnight. So the big difference between having something done in the office and having something done at the facility, such as a surgery center or the hospital, is in the office we do not start an IV. You're relaxed, you're mellow, you're numb, but you're awake. And at the facility, such as the surgery center or hospital, that an IV is started, there's an anesthesiologist there, you can take a nap if you like, and you can just tell the anesthesiologist how deep you want to go. So the decision ultimately is up to you. However, I can give you advice about this. Again, in the office, we tend to do people who are relatively young, you need to be healthy, or have no uncontrolled medical problems. We like to keep procedures in the office under 4 hours. After about 4 hours, people tend to get a little bit antsy. They might want to go to the bathroom. They might want to get up and have something to eat. So for the office, we commonly do neck lifts. We can do mini facelifts. We can do eyelids. We can do some areas of liposuction. For the surgery center or the hospital, it's larger volume of liposuction, longer procedures such as a complete facelift with the eyelids, etc. So those are options that I think it's very important that we discuss during your consultation because, as I said, choosing the location for your surgery is one of the most important issues we can address.